8 minutes and 40 seconds start.
Muhammad, did you tell him what to do first?
Yes, the riff
أيوة
notes first. The first, yes, continue riff note.
يساوي صار في فلوت.
Yeah, yeah. Which type of social material will you use, doctor?
I will silk braided silk.
Can you name other note apart from the riff note?
There is a surgeon note, granny note, and sleep note.
Why Sergio not more stable than the granny note, doctor?
Can you continue suturing while we're asking you, please?
Because there is the surgeon notes, the two house stitches are going on opposite direction, so it's more stable than the granny note, which is both the both half stitches are going in the same side.
Okay. How many notes you will do in this riff note?
At least four.
Okay, continue. Did you done the 4 note?
Yes.
Yeah. So could you please go to the note at depths, please? Before that, what type of suture material will you use in this note at depths?
I will braid it by acrylic.
Vicryl?
Vicryl, yes, 3O.
Okay. What is the vicryl is made from and when it fully absorbed?
It is polyglactin. It is absorption in 56 to 70 days and with tensile strength for 2 to 3 weeks.
Mm-hmm. How many notes you will do for this riff note? For the note at depths?
At least 4 to 3 notes.
Yeah. Do 4 note, please.
It is clear for you now.
Okay.
And the other, same as riff note. I will make it loose, then I will push by my finger.
Okay.
You don't need to explain, just do it, yes. If you can ask him any question, Muhammad.
Yeah. What are the advantages of braided suture, doctor?
The braided suture is flexible and easy to be handled.
How can you protect tissue while tying a knot at depths?
I will ensure more light, and then tissue retraction. Then I will make first tie loose. Then I will push by my finger.
What else?
I don't recall it.
While you're doing the suture, doctor, do you know why we're doing this suture? In which cases? I want no, don't please answer while you're doing it, please. Answer while you're doing it, yeah.
In deep cavities.
In deep cavities, yes. And why we are very cautious not to pull it up?
Because of the tissue is being very fragile and maybe evulsed when you are tensing it.
So can you say that again, please? Can you explain it more?
The tissue will be fragile, and if you did more tension, you will evulse it.
Oh yeah. So you will damage the artery or the structures. Okay.
Yes.
All right. Okay, Muhammad, continue.
Okay, and could you please go to the bleeding point?
Can you put the bleeding point in front? Take this at depth, leave put it outside the camera and put this in the center. Yeah.
Yes.
You have elevator, right? You just took an elevator, the one on the back, the white thing. Yes.
Do it here.
Yes.
Do it, please.
Ask him, Muhammad, while he's doing.
Yeah. I will do that, Ali. What type of suture material will you use in this bleeding point, doctor?
I will use Prolene 3O also. This is a knife. but I will use it.
Okay. And what the pros and cons of monofilaments against multifilaments?
Less tissue trauma.
Which is the less tissue trauma?
Less tissue trauma, this is advantage. And no less reaction, tissue reaction. But the disadvantage, it is difficult to be handled.
But doctor, please determine what about you are talking, monofilament or multifilament?
It is monofilament.
Continue.
So what's the advantage of the monofilament while you're suturing?
Less tissue trauma.
Yeah.
And less reaction, tissue reaction.
All right. And what's the disadvantages?
Advantages is difficult to be handled.
Yeah.
And need more tie to secure it.
Okay.
Okay, what about the multifilament?
Multifilament is the advantage is easy to be handled and to be less not needed. And the disadvantage is tissue reactions. Make it a figure. I don't know it's clear.
Can you give me examples of monofilament sutures?
Monofilament and non-absorbable like proline and nylon, and absorbable like monocrete.
And examples of multifilaments?
Multifilaments, non-absorbable like a silk and ethipone, and absorbable like vicryl.
How many knots you will do for this bleeding point?
4 to 6.
Do 6, please. Yeah. You have 40 seconds. Continue.
All right.
Can I see the bleeding point, please?
Yeah, good.
Figure 8?
Yes. What you gonna do next?
Yeah. You have 20 seconds.
I will discard
Dispose it, please.
Yes, in the sharpening.
Yeah, dispose it.
What else?
Okay, time up.
What else you gonna do?
Yeah. Time up.
Yes.
So, Ali, can I start?
Okay.
Or do you start?
You can start, Muhammad.
Okay, very nice, Fatah Rahman. And not tying, I think, one of the difficult sessions in the procedure skills. You answered
And the
all
most common.
most common, yes. We usually start by riff note, and you answered all questions regarding it correctly. But can I ask you how many notes you will tie for riff note?
4 notes.
طيب مش كده.
I can.
Yes, perfect. And regarding the note at depths, you answered correct. The type of sushi material is Vicryl 3O. And the advantages of braided sushi, you answered correct. And how can you protect tissue? Can you answer this question again? How you can protect tissue while tying a knot at depths? You have 3 things you should say.
I will ensure good light
Visibility with more light.
And with more light, tissue retraction,
Retract
gently,
and adjust tissues and
and make the first tie loose. Then I will secure it by pushing it down by my finger.
yes,
And
making the initial knot loose before the securing it by pushing down with your finger. Excellent. Regarding the bleeding point, you answer the question correct, which is Berlin 300, and you answer the pros and cons of monofilament right. But figure 8, I think it's loose, Fath Rahman. You should make it clear,
No,
like
is it strong? Is it strong? I saw it.
strong, very strong.
Very strong. I saw it, Mohammed. Yeah.
Yeah. Otherwise, I have no comment. Very nice, Fath Rahman. Perfect.
So, Fatah Rahman, first let me ask you, how many did you practice this station the same way we did now?
I saw your video.
No. I mean, like, how many times you did exactly what you did now? Like, you put on the timer and you did the station while someone is asking you questions.
To be honest, 2 or 3 times only.
And
Yes.
someone was asking you question while you're doing that.
No, I 2 or 3 only. Just
No, was there any person who's asking you question while you're doing it?
no. I'm opening the school and reading and answering during the practicing.
Perfect.
All right. Okay.
Because I know
So
during, so I need to train myself to talk
yeah.
and proceed with the note.
Okay. So yes. So that's the way you should do it. As you notice, it's not easy. It's very difficult. Even if you are experienced surgeon, while they're asking you during the stress of the exam, it's not easy at all. If you've done it multiple times, you need to do it same way as the exam. Your performance here is brilliant, very good, but you stop sometimes while you answering. I think that's a normal, yeah, that's a normal response. But I want you to reach a level that you do not stop for a second. You answer while you suture. You did that, but there's some stopping. You can review the recording later on.
Sure.
This will not mark you negatively, but just do it this way. Suturing without no mark, with no stop. And I don't want you to touch the needle at all. You touch the needle multiple times.
I touch in the bleeding point.
With your hand. So you should not touch the needle.
Yes,
I know in theater we touch the needle. I know that, but you shouldn't touch the needle in the exam.
Yeah, the other point, Ali, also read the expiry date by raising your voice, yes, to the examiner.
Yes. Make sure your examiner knows that you are reading the expiry date. And how you do it, you say expiry date 2027. You just make it up, okay? Don't make it in the past. Yes.
Yeah. Expiry date 2027.
Yes. And then while you're suturing, the end of the suture, I think in figure 8 was too long. The end of the suture. You went so far to grab it.
Yes.
It should be 4 or 5 centimeters, so you don't suffer to grab it. And
yes.
I saw you rushing during the suture. Don't rush. Take your time. You still had time before you finish. I asked you at the end, what is the last thing you can do? You should say documentation.
Yes.
Yes.
So after discarding your sharps, tell your examiner, now I want to document. And from now on, I want you to bring multiple gloves and practice with gloves on.
Yes.
From the next time. And this is not just for you, for everyone. We want to practice with gloves on because this is very difficult. Yes. So when we finish this station and you have free time, you can practice with the gloves on. That's very important.
Yes.
But you're gonna pass this station. Obviously, you answered all the question. You didn't miss any crucial point. It's just this tiny skills. Okay.
Yes.
Yeah.
Good, Fatah Rahman. Very good.
Should we go to the next station?
Yes.
Wound suturing. Allah, please unmute yourself. Open your camera, and everyone be in Allah, please.
Ahmed, welcome back. We're gonna speak with you later on. It's all recorded. Don't worry.
Okay.
Yes. Okay. Let's start.
آلاء.
Yes.
Okay. 25 years old man present with a clean wound on his side, sustained 7 hours ago. Approximate the edges of the wound using sterile technique. Okay.
Do you have gloves, Salah, or no?
I have, but I think it's big. It's okay?
That's fine, yeah. You can put them on.
Okay. Okay, يلا.
8 minutes and 40 seconds started.
Hello, mister. How are you? I'm Dr. I'm Dr. Ala, one of the surgical doctor. May I confirm your name and age, please?
Hello, doctor. My name is Muhammad and I am 27 years old.
Nice to meet you, Muhammad, Mr. Muhammad. I have been asked today to take care of your wound in your arm and approximate the age. So under numbing agent and sterile condition. Is that right with you?
Yes.
Okay, I will. Okay, but before we start, I would like to ask you a few questions for a check, for safety check. Do you use any blood thinner like clopidogrel, aspirin, and warfarin?
No.
Okay. Have you had your tetanus vaccine recently, or do you know if you are up to date?
Yes, I took it recently for this wound.
Yeah, good, very nice. Okay. Do you have any allergy to lidocaine or chlorhexidine?
No, I have no allergies, doctor.
Okay. Do you have any allergy to any material of suturing?
No.
Okay, that's nice. Okay. Before I start, I would like to take recent written consent from you. Okay.
Yeah.
For the procedure.
Already taken, doctor.
Okay, nice. And I will check the WHO surgical list, safety surgical list.
Already checked, doctor. You can proceed.
Okay. Okay, I will start now.
Okay.
Not clear. If you can you bring someone to hold the camera or
Yeah,
just,
it's
yes.
clear.
Yeah, now clear. Yes.
Okay. Okay, is it clear?
Yes.
Okay. This is non-absorbable, non-absorbable suture. The date of expired one of 2030 year 2030.
All right. Okay.
Okay, doctor. When I can go to home?
You will go home recently after the suturing. It will not take a long time, and I will send with you antibiotic and painkiller.
Muhammad, you are the patient. I'm the doctor. I'm the examiner.
Yes.
Okay. Okay. Continue, doctor. So this is your suture. Yeah.
Yes.
You can speak to your patient whenever you want. Okay.
Okay.
Doctor, is it painful?
It's not painful because because you are injected with numbing agent, so you will not feel pain. But if you feel pain at any point, please let me know. I will add another dose.
Okay, thank you so much.
You're welcome. Okay, I will start now, mister. You may feel a sharp scratching. So when I insert the needle, okay?
Okay.
Okay. You feel pain here? You feel pain here?
Yes. I'm okay. Continue.
You feel? Okay, we'll start now, okay?
Doctor, what about the showering and bathing? Can I do it?
No, at least you are advised to wait like 24 hour before take shower because you want the wound be dry.
Okay.
Okay.
So, doctor, what's the type of suture material will you use in this suture? In this for
I
this
will
wound?
use
Mm-hmm.
I will use non-absorbable suture.
Which type exactly, please?
I have no idea.
Okay, continue while you're doing. Yeah.
Okay.
What analgesia will you give your patient?
I will give lidocaine 1%. Yes, local anesthesia, lidocaine 1%.
Okay. Can you calculate it in mils?
Yes. It's 3 milligram per kg. And
While you're
then
suturing, doctor, please don't stop. Yeah.
yeah, it's 3 mil per 3 mg per kg. The maximum dose is 20 mil.
20 mils. Okay.
Yes.
And if your patient is allergic, and if you want to
Uh,
give it, sorry, if you want to give it with adrenaline, how will you
yeah.
calculate it?
Okay. We increase the dose up to 7 mil per kg. 7 mg per kg.
Okay.
Yes.
And if your patient doesn't tolerate the lidocaine, what's your other choices?
I will give Bovicine, dose 175 mg, equivalent to 7 ml of 0.25% concentration.
Okay. Muhammad, continue asking the question, please.
Yeah. Let's do the second stage.
I want you to ask her while she's doing the stitch, Muhammad.
Okay, doctor. And what
Okay,
about
so
the dressing of my wound, doctor? When I can do it?
okay, you can do the dress after 2 days, and then um day after day. I will give appointment for that, and then you can. I will give appointment for that, and then you need to come back after 10 days for. You will come back after 10 to 7 days for remove the stitches. Sorry.
Mm-hmm.
Yes. So if you notice any pain or any discharge or any bleeding, please, or any symptomatic symptom like systematic symptom like fever or no or nausea, please please seek medical advice or visit near hospital too.
Okay, thank you, doctor.
You're
And
welcome.
how do you address the risk of infection in wound management?
Yeah, I will give you broad spectrum antibiotic, okay, to decrease 2 dose. You already take 1 dose pre-op, and then remaining 2 dose you will take it post-op, and the wound is already clean. So, and you already have take 1 dose before the surgery.
Can you tell me more about the antibiotic requirement based on the infection risk?
Yeah, if it was clean, no need for for antibiotic. But if it was clean plus contaminated,
Time
like
up, time up, time up. How many
All right.
how many stitches you done, Ala?
Two.
one and a
Two.
half.
Two. Good,
Two?
good, Ala. Ala, yeah.
Yeah.
Muhammad, do you have an important question or you want to start the discussion?
Yeah, I would like to start the discussion.
Yes.
Ala, very nice. I think this is your first time while there someone asking you during our procedure, but you did very great job. But let's review from the beginning. You explained to me, hello, my name is Ala. I'm one of the surgeons. I have been asked Ali, in this station, you can say I have been asked because some consultant tell you to do this stitch, or you can say I am surgical doctor. I would like to approximate the edges of your wound. This will be
Yeah,
administrative
yes,
and numbing agent. Yeah,
yes, it's
both
fine.
both of yeah strategy is okay. And I'm so happy that you check the WHO checklist and you ask me about the blood thinner medication and allergies. Very nice. The examiner love these questions. And you started by checking the expiry date. Very nice. But Ala, there is an important point you forgot, which is check the pain before insert the first needle or first stitch. You
She
didn't
checked
check.
the
I did.
band.
I
She
did
checked the
this.
band.
Yeah,
She
I
checked the
did like
band,
this.
but the thing that I think in the station they may tell you the patient is already
Anesthetic,
numbed,
yes. Yes.
but there is a chance they may tell you the patient didn't receive any analgesia. In this case, you have to make sure that you give him the lidocaine. The lidocaine.
Yeah. But I think I
Yes.
faced this session in my exam, and the patient is already taken his numbing agent. Regarding the patient questions,
So
Ala,
that's Muhammad. Just 1 second. So that means you have to read the scenario very carefully, Ala. If the
Okay.
patient didn't receive the numbing agent lidocaine, you should give him the lidocaine inside and wait for 5 minutes. You tell your examiner, "I'm going to wait for 5 minutes." He will tell you to skip it, and then you start by asking, "Do you feel any pain?" If they told you already he received the lidocaine, then you come inside. You confirm with the patient. You say loudly, "I know that you received your lidocaine, your numbing agent. I'm just gonna test it. Do you feel any pain?" He will tell you, "I don't feel any pain." Then you start the procedure, and the patient will be lying down, and this suture exactly will be on top of his thigh or chest or whatever. You will speak with your patient directly, okay? Or it could be a
I will.
plastic, could
yes.
be
I
a
will suture
manicure,
on a real patient.
it could be a real patient, or it could be manicure. By real patient, the patient will not have a wound. He will be a healthy person, but they will tie this,
In his thigh,
the
yes.
one that you have now.
Model in
They
his thigh,
will
yes.
tie on his chest or on his thigh,
Okay.
and he will suture on it. Okay,
Yeah.
don't put the needle in his real thigh.
Yeah,
Okay.
Ala, I used to practice by before insert the first stitch because after inserting the first stitch, the examiner will start to ask you. So I used to say all my instruction to patient before I insert the first stitch. Okay, Mr. Jack, after this stitch, you can go your home immediately. Also, please avoid showering and bathing for the next 24 hours. Am I clear? Then I have 2 points also I would like to say to my patient, which is we need to readdress after 24 hours, then day after day. I will give you appointment for that. And I will give you also another appointment to remove the stitch after 7 to 10 days.
Okay.
This is the
Should I?
5 points you should say to your
Oh.
patient.
Oh,
If you
okay.
didn't say it to your patient and your patient is so cooperative, he may ask you. But you should say it to take the mark of professionalism and communication skills.
Okay.
This 5
So you
points.
can say it at the start quickly, or you can do it while you're doing the suture.
Yeah, I use it to say
Okay.
it previously, Ali, because when the
I
examiner
think that's
started to
better.
asking you, it will
I think
confuse
that's
you.
better,
Yeah.
Muhammad.
Yeah.
Yes,
I think that's better, and it would only take 50 seconds to say all of this.
Yeah, while
It will take you
preparing
50.
your needle and suture material. Okay, Mr. Jack. After this session, you can go to your home immediately. Please avoid showering and bathing for the next 24 hours. Regarding the readdressing, I advise you to readdress after 24 hours, then day after day, and we will remove this after 7 to 10 days. I will give you appointment for all that. Otherwise, you answered all questions correctly regarding the examiner questions. I have no any point to comment about. But Ala, regarding the maneuver exactly, you did very wrong thing, which you hold the needle by your hand couple of times, right? Try
Yeah.
أيوة.
to not hold the needle by your hand, and this is the fatal mistake.
Yeah. Okay.
It will affect your mark, obviously. Also, when you hold the needle by the needle holder, I need to demonstrate this. Ali, you can start with her while I am preparing for the suture.
Yes. So do not hold the needle at all, Ala, by your hand, and also when you take the first bite, don't move all the thread. الخيط ده شايفاه وما تطلع للنهايه. You take the first bite, just move it a bit, then take the second bite, then take it all the way. Do you understand what I'm saying?
Yes, yeah,
So
yeah, yeah.
imagine this is your
Yeah.
suture.
Yes, yes.
All right, this is your suture. You take the first bite with your suture.
Mhm.
You go
Yeah.
in, okay? Don't move it
Okay.
all the way to the end. Just
Yes.
just go inside like this. Muhammad will show you in a second. I'm gonna bring my suture. So just go inside like this. Don't move it to
Yeah.
the end, and then take the second bite from here. All right, and then do the suturing. And I also gonna show you later on when you take the first bite and you take the second bite. You can use, imagine this is a thread. You can use the thread to move it this way, to move this way. Don't move the needle too much.
Mm.
Okay?
Okay.
Muhammad will show you in a second. Okay. The other point I want to say, um, you know, when you are trying to secure your suture, this is your Caesar. Imagine this is your Caesar. You kept it open while you securing it. So the teacher should be closed while you're suturing, and then you open it, you grab the end of the suture and you close it. Do you understand? So
Yes.
I saw you multiple times doing this. Like you wrap the thread around the Caesar while it's open. Keep it closed
Mm.
while you're wrapping it, and then you take it from the end. Okay? But this is a minor mistake. If you just practice for 3, 4 times, that will be helpful. I think you have a very good skill at speaking while you're doing the suture, which is very good. So you can speak while you're doing the suture. That's fantastic. I'm so glad that you mentioned all the important points at the start. This will give you a very high mark. Name, consent, expiry date, allergy, blood thinners. These are very important. Okay? We'll leave it
Okay.
for Muhammad.
Ali,
Yes, Muhammad.
didn't find it. But Ala, can you hold the needle again, please?
Okay.
I will show you. Let me open the camera. Yes. Hold it and show me, please. Yes, yes. The lateral third, right?
Yes.
Yes, hold it again, please. We have 3 minutes. We can demonstrate this.
Yeah, I'll try to be faster.
امسكها بيدك ما مشكلة، احنا بس دايرين يعني نعرف الطريقة الصحيحة. ارفعها بيدك فوق وامسكي من التلت للأخير. ارفعها بيدك عادي، النيدل بيدك، ايوه ما
كده.
مشكلة. ايوه. يلا بس عشان اوريك تمسكي من وين بس بالضبط، وتخلي اي جزء ظاهر. امسكيها فوق يا علو
Muhammad,
وجيبيها. ايوه.
you can stop the recording. It's all right.
اوكي.